I'm Vincent Ford, I'm CEO and founder of Gasgon Medical. I'm a mechanical engineer with a background in retail, design and engineering. I founded Gasgon Medical in 2018 as a solo founder. At that time I was just out of college, having studied mechanical engineering in Cork Institute of Technology, and the business began as a college project. Now, when I left college I went straight into New Frontiers incubator programme by Enterprise Ireland. I was interested at that point in learning the business structures required to gain investment to build a business. You could say I was fairly dogged from the outset. I just needed the supports to properly establish the foundations of the business. Gasgon Medical develops a technology to remove air bubbles from IV infusion lines. IV infusion is the most common invasive therapy in modern healthcare, and it is used in almost every area of medical treatment, with over 80% of hospital patients receiving IV as part of their treatment. It's also widely used in home care and community care settings. Every IV infusion has a risk of bubbles entering the patient's venous systems, and these bubbles can result in harm such as heart rhythm disruptions, cognitive dysfunction and strokes. Nurses are typically charged with manually removing the bubbles from the IV, which is both time-consuming and risky for the nurse and for the patient. What we do is automate that process, stopping the bubble problem at source and making the infusion safer, more accurate and cheaper to deliver. Now, we identified DBIC Ventures as a potential partner early on, among other VC firms we were looking at. We did our due diligence and looked at interviews with Richard Watson and just liked his attitude towards backing early stage ventures. I really appreciated his background in medtech startups. He had been in these trenches and got the nuances of this world, and that was important for me, that our investment partners understood the journey ahead and could help us strategically. DBIC made the investment process really easy from the beginning. They were initially very engaged in understanding the background and the solution, genuinely excited about solving the problem and then offering good insights on our business plan. As the round progressed in the early stages, we asked DBIC to lead and they said yes, which I think gave all the other investors confidence to see a VC taking charge of the round. DBIC were always fully in control as a lead, sharing paperwork and updates. I think everyone knew where they stood at all times. DBIC chaired meetings with the investment groups to ensure alignment, and from a company point of view, this was really helpful.